Hello, wonderful people out there. You're welcome to our channel, Ask Nos Malik channel. Today in this video, I'm going to simply explain a question that one of our subscribers asked earlier today on our comment box. Like I've told you, you should always make sure you ask your question under the comment box and response will be given to you. That question that is bothering you, that condition that is bothering you that you want to ask for a long time, you are always free to ask from us. As you all know that I am your trusted source of reliable health tips on your reproductive health, overall health, and your general health. So feel free to ask your question under our comment box. One of our subscribers asked this question earlier this day that what is Azoospermia, what is Oligospermia, and what is Aspermia? These are health related questions. These are reproductive health related questions, and these terminologies you can't understand it if you don't know what it means. It is very difficult to understand, but I'm trusting you, I'm assuring you that at the end of this video, if you watch this video till the end, you are going to understand these simple terms. I'll call it simple terms because I'm going to make sure I explain everything to you in a simple way that you are going to understand. Firstly, I'm going to talk about what is related to these terminologies that this subscriber just listed. These are terminologies used in male reproductive health regarding especially their semen and their sperm. It's all about their sperm health. When you say oligospermia, I'll start from there. Oligospermia is a condition where you have low sperm count. That is when a man produces low sperm or low sperm count in their semen. Most of the men suffer from this condition of low sperm count in their semen, which will enable them to fertilize the egg of their woman, which is one of the most common causes of infertility in men. Oligospermia can result as a result of hormonal imbalances due to low testosterone level that can help in the production of those sperm that helps in fertilization. It can also be as a result of infections, as a result of trauma or injury to your testicles. These are some of the things that can actually cause low sperm count. So inability of a man to produce enough sperm during ejaculation or during sexual intercourse, it is referred to as oligospermia. Then the other two questions the subscriber asked is Azoospermia and Aspermia. These are two related words that you have to know the differences. These are both related to sperm and semen. You have to understand what is sperm and also you have to understand what is semen. When you say sperm, sperm is produced in your testes that helps in fertilization of the egg cells in the woman. Then when you say semen, your semen is the first fluid that comes out of the penis in every ejaculate. So if you're a man and you've noticed maybe during any sexual arousal there's a fluid that filled the top of your penis, that is a semen. It is different from sperm. Sperm is the milky and the thicky part of those ejaculates. But you see the semen is a clear transparent fluid that comes out with sperm. So this semen composes many things. It composes of water, sperm, the fructose, amino acid, proteins and enzymes and all of that. Then there are certain functions that this semen can actually do. They protect the sperm. They also help in transportation of this sperm from your penis to the vagina of your woman. Then 3, they also make sure they provide enough glucose, enough energy for the sperm during the motility, during the movement that the sperm is moving or transporting itself down to the vagina. Then 3, they can also serve as a lubricant or as a lubrication for the sperm in order for it to move out to be motile. So they serve as lubrication. These are some of the importance or some of the functions of those semen you have with your ejaculate. So we want to know the differences between these two conditions. When you have azoospermia, azoospermia means the absence of sperm in a semen. So in every ejaculate that you have, you are expected to have both your semen and your sperm. These are two different things. So in a condition where you have just the semen and you don't have the sperm produced, it is referred to as azoospermia. So what are those things that can cause this azoospermia? Azoospermia can be as a result of obstruction or non-obstructive. That's when there's an obstruction to the reproductive tract that helps in the passage of those sperm from the testicles. And also it can also occur as non-obstructive azoospermia. That is absence in the production of those sperm that can help in fertilization of the egg. This azoospermia can occur as a result of hormonal imbalance or genetic disorders, or when you have trauma or infections or viruses, or when you are undergoing a cancer treatment. Then when you talk about aspermia, aspermia is also referred to as anejaculate. That is inability to ejaculate semen during ejaculation or in every orgasm that you have. Inability of a man to produce a semen is referred to as aspermia. So in conclusion, you should be able to know how to differentiate these three conditions. Oligospermia is when you have low sperm count, that is, you are producing both the sperm and the semen, but it is low in production. But when it comes to azoospermia is there is production of semen, but there is absence of sperm. And this semen, don't forget, this semen can't fertilize the egg. It is the presence of the sperm that can help in fertilization of the egg. So that is azoospermia. Then when it comes to aspermia, that is presence of sperm but no semen. And this semen is the protecting power of the sperm, is helping mobility and transportation of the sperm from your penis down to the vagina of a woman. So all these components of your ejaculate really matters a lot. That is why it is important as a man for you to take care of your reproductive health. Thank you to this wonderful subscriber that asked this question. This question will go a long way to help some other men there facing this condition. So like I always tell you, don't forget to ask your question. Feel free to comment your question under the comment box and quick response will be given to you. Till we meet again in our next video. If you've enjoyed this video, don't forget to hit the like button, comment your question under the comment box. I will say again, and don't forget to subscribe if you are just meeting our video.